Narcissism versus narcissistic personality disorder. How to spot the differences. Narcissism and narcissistic personality disorder or NPD are two terms that are often used interchangeably, but they are not the same thing. While both involve an excessive focus on oneself, there are some key differences between the two. Understanding these differences can help you recognize if someone you know is exhibiting narcissistic behavior or if they have NPD. What is narcissism? Narcissism is a personality trait that involves an excessive focus on oneself. People who exhibit narcissistic traits are often preoccupied with their own needs, desires, and achievements. They may have an inflated sense of self-importance, a need for admiration, and a lack of empathy for others. However, not all people who exhibit narcissistic traits have NPD. So, what is narcissistic personality disorder? Narcissistic personality disorder or NPD is a mental health condition that is characterized by a pervasive pattern of grandiosity, a need for admiration, and a lack of empathy. People with NPD may have an exaggerated sense of self-importance and a belief that they are entitled to special treatment. They may also have a sense of superiority over others and may be preoccupied with fantasies of success, power, and beauty. However, not all people with NPD exhibit all of these traits, and the severity of symptoms can vary. How to spot the differences? While narcissism is a personality trait, NPD or narcissistic personality disorder is a mental health condition. NPD is diagnosed when a person exhibits a pervasive pattern of grandiosity, a need for admiration, and a lack of empathy that begins in early adulthood and is present in a variety of contexts. It's important to note that not everyone who exhibits narcissistic traits has NPD. There are several key differences between narcissism and NPD. First, narcissistic traits are relatively common and may be present to some degree in many people. In contrast, NPD is a relatively rare disorder affecting only about 1% of the general population. Another key difference between narcissism and NPD is the degree to which a person's behavior interferes with their ability to function in daily life. While narcissistic traits may cause interpersonal difficulties or lead to problems at work or in social situations, they typically do not cause significant impairment in a person's life. In contrast, NPD can be highly disruptive, causing significant problems in a person's relationship, work, and overall functioning. A third difference between narcissism and NPD is the degree of distress that a person experiences as a result of their behavior. While people with narcissistic traits may experience occasional feelings of guilt or shame, they generally do not experience significant distress as a result of their behavior. In contrast, people with NPD may experience significant distress as a result of their behavior, such as feeling isolated or misunderstood. It's also worth noting that while narcissistic traits can be found in people of any gender, age, or cultural background, NPD is more commonly diagnosed in men than in women. In order to diagnose NPD, mental health professionals use a set of criteria outlined in the Diagnostic and Statistical Manual of Mental Disorder, or DSM-5. These criteria include a pervasive pattern of grandiosity, in which a person exaggerates their achievements and talents and expects to be recognized as superior without commensurate achievement. a preoccupation with fantasies of unlimited success, power, brilliance, beauty, or ideal love, a belief that they are special and unique and can only be understood by or should associate with other special or high-status people. A need for excessive admiration, a sense of entitlement in which a person feels they are entitled to special treatment or privilege, a tendency to exploit others for personal gain, a lack of empathy in which a person is unwilling or unable to recognize or identify with the feelings and needs of others, a tendency to be envious of others or believe that others are envious of them, arrogant, healthy behaviors or attitudes. If you suspect that you or someone you know may be exhibiting signs of NPD, it's important to seek the help of a mental health professional. NPD can be a difficult condition to treat, but with the help of a skilled therapist or counselor, people with NPD can learn how to manage their symptoms and improve their relationship with others. There are also some key differences between the two. Here are some of the main differences. Severity of symptoms. People with NPD have a more severe form of narcissism that affects their ability to function in their daily lives. Their symptoms are pervasive and may impact their works, relationships, and other areas of their life. In contrast, people with narcissistic traits may have some of the same characteristics, but their symptoms are not as severe and do not impair their ability to function. Empathy. One of the key differences between narcissism and NPD is the ability to feel empathy for others. People with NPD have a profound lack of empathy and often cannot understand or relate to the feelings of others. They may be indifferent to the suffering of others and may even enjoy causing harm. People with narcissistic traits may lack empathy as well, but to a lesser degree. Self-image. People with NPD have a rigid and inflexible self-image that is often based on unrealistic expectations. They may believe that they are perfect and superior to others, and any criticism or feedback is seen as a threat to their self-image. People with narcissistic traits may also have a grandiose self-image, but it is not as rigid or inflexible. Ability to function. People with NPD often struggle to function in their daily lives due to their symptoms. They may have difficulty maintaining relationships, holding down a job, or managing their emotions. In contrast, people with narcissistic traits may still be able to function in their daily life despite their symptoms. Treatment. While there is no cure for NPD, treatment can help manage the symptoms and improve the person's quality of life. People with NPD often require long-term therapy and may also benefit from medication to manage their symptoms. People with narcissistic traits may also benefit from therapy, but their symptoms may be less severe and may not require as intensive treatment. In conclusion, while both narcissism and narcissistic personality disorder involve an excessive focus on oneself, there are some key differences between the two. One of the key differences between narcissism and NPD is the degree to which it affects an individual's daily functioning. While narcissism may be considered a personality trait or a pattern of behavior, NPD is a diagnosable mental health condition that requires professional intervention. NPD can significantly impair an individual's ability to maintain healthy relationships, hold a job, and live a fulfilling life. Another important difference between narcissism and NPD is the degree to which it causes distress to the individual. While narcissism may be seen as a positive trait in some contexts, such as in leadership roles or high-pressure careers, individuals with NPD often experience significant distress as a result of their behavior. This distress can manifest in the form of depression, anxiety, or other mental health conditions. It's also worth noting that NPD is a relatively rare condition, with estimates suggesting that it affects only around 1% of the general population. This means that while many people may exhibit narcissistic traits or behavior, not all of them will meet the criteria for a diagnosis of NPD. In any case, if you suspect that someone you know may be exhibiting narcissistic behavior or may have NPD, it's important to seek professional help. A mental health professional can provide a diagnosis, offer treatment options, and help you navigate the complexities of your relationship with the individual in question. It's also important to prioritize your own mental and emotional well-being in this situation. Narcissistic behavior and NPD can be emotionally draining and may require you to set boundaries or seek support from a mental health professional or support group. Remember, seeking help is a sign of strength, and taking care of yourself is always a worthwhile investment.